Hello and welcome. Today we're diving into a specific type of cancer that affects the urinary system, transitional cell carcinoma, specifically focusing on its occurrence in the ureter. This video aims to provide a comprehensive overview of this disease, covering everything from its causes to its management. So, what causes transitional cell carcinoma of the ureter? The exact cause isn't fully understood, but several risk factors have been identified. Smoking is a major contributor, significantly increasing the risk. Exposure to certain industrial chemicals, particularly aromatic amines used in the dye, rubber and textile industries, is also a known risk factor. Other potential risk factors include chronic urinary tract infections, long-term use of certain pain medications containing phenacetin, and a family history of urothelial cancers. Essentially, anything that chronically irritates the lining of the urinary tract can increase the risk. Now let's discuss the pathophysiology. The ureter is lined with transitional cells, also known as urothelial cells. These cells are highly adaptable and can stretch and contract as the ureter transports urine from the kidney to the bladder. Transitional cell carcinoma begins when these normal cells undergo genetic mutations, causing them to grow and divide uncontrollably. These abnormal cells can form a tumor within the ureter. As the tumor grows, it can obstruct the flow of urine, leading to hydronephrosis, or swelling of the kidney due to urine backup. The cancer can also invade deeper layers of the ureter wall and eventually spread to nearby lymph nodes and other organs, a process called metastasis. Understanding the epidemiology helps us grasp the prevalence and distribution of this disease. Transitional cell carcinoma of the ureter is relatively rare compared to bladder cancer. It accounts for only a small percentage of all urothelial cancers. It's more commonly diagnosed in older adults, typically between the ages of 60 and 80. Men are also more likely to develop this cancer than women. Geographical variations exist, with higher incidence rates observed in regions with significant industrial activity or higher rates of smoking. What are the signs and symptoms to look out for? The most common symptom is hematuria or blood in the urine. This can be either visible or only detectable under a microscope. Other symptoms may include flank pain, which is pain in the side or back, frequent urination, urinary urgency, and pain during urination known as dysuria. In some cases, the tumor may cause a complete blockage of the ureter, leading to severe pain and kidney dysfunction. It's important to note that these symptoms can also be caused by other conditions, so it's crucial to seek medical evaluation for proper diagnosis. Diagnosis typically involves a combination of imaging techniques and tissue sampling. A urine cytology test can detect abnormal cells in the urine. Imaging studies, such as a CT urogram or an MRI, can help visualize the ureter and identify any tumors. A ureteroscopy, where a thin, flexible tube with a camera is inserted into the ureter, allows the doctor to directly visualize the ureteral lining and take biopsies. The biopsy is then examined under a microscope to confirm the diagnosis and determine the grade and stage of the cancer. Staging helps determine the extent of the cancer and guide treatment decisions. While there aren't distinct types of transitional cell carcinoma based on cell structure in the ureter specifically, the grading and staging are crucial. Grading refers to how abnormal the cancer cells look under a microscope. High-grade tumors are more aggressive and likely to spread. Staging describes the extent of the cancer spread from stage 0, which is confined to the inner lining, to stage IV, where the cancer has spread to distant organs. Treatment options depend on the stage, grade, and location of the tumor, as well as the patient's overall health. Surgical removal is the primary treatment for most cases. This may involve a nephrectomy, which is the removal of the kidney and ureter, along with a portion of the bladder cuff. For small, low-grade tumors, a less invasive approach, such as endoscopic resection, may be an option. Radiation therapy and chemotherapy may be used in conjunction with surgery, particularly for more advanced stages of the cancer. Intravesical therapy, where medication is instilled directly into the bladder, may also be used to prevent recurrence after surgery. Regular follow-up is essential to monitor for recurrence. While it's impossible to completely prevent transitional cell carcinoma of the ureter, there are steps you can take to reduce your risk. Quitting smoking is the most important preventative measure. Avoiding exposure to industrial chemicals, maintaining a healthy lifestyle, and staying hydrated can also help. Individuals with a family history of urothelial cancers may consider genetic counseling and increased screening. The prognosis for transitional cell carcinoma of the ureter varies depending on the stage and grade of the cancer at the time of diagnosis. Early detection and treatment significantly improve the chances of survival. Recent research is focused on developing more targeted therapies that specifically target the cancer cells while minimizing side effects. Immunotherapy, which harnesses the body's own immune system to fight cancer, is also showing promise in treating advanced urothelial cancers. Ongoing clinical trials are exploring new treatment strategies to improve outcomes for patients with this challenging disease. Thank you for watching, and we hope this video provided you with a better understanding of transitional carcinoma of the ureter.